The COVID-19 crisis has revealed the catastrophic impact of the lack of social protection coverage for 4 billion people around the world. Social security is a human right, and the acute need for social protection is more evident today than ever before. However, 55% of the global population is completely unprotected. This is linked to insufficient progress in closing social protection financing gaps. To guarantee at least basic income security and access to essential healthcare for all and close the annual financing gap for 2020 alone, developing countries must invest approximately $1.2 trillion. On average, this is 3.8% of their GDP. For low-income countries, however, they represent about $80 billion of this total financing gap, which means around 15.9% of their GDP. National and international efforts to mitigate the COVID-19 crisis, as we have seen, have provided some short-term financing assistance, but this is nowhere enough to close the gaps that are needed. Now, many options exist to increase the fiscal space for extending social protection to everyone, such as increasing the taxation level, or eliminating illicit financial flows, or reallocating public expenditure. Now, while creating fiscal space through domestic sources is a priority, this option is not going to be enough for most low-income countries, where the social protection financing gap is extremely high compared to their very limited fiscal capacity. Therefore, domestic resource mobilization has to be complemented by international resources based on global solidarity. Closing these gaps is both necessary and achievable. With concerted political will, we can make this happen, and we can make social protection for all a reality.